record.
My name is Elizabeth Ganford, and I will be doing an abdominal assessment on my friend Justin here. First of all, you want to introduce yourself and wash your hands prior to doing anything with the patient, and just do an overall general assessment, checking their level of consciousness and their general state of well-being. So from there, we're going to go ahead and go right into the abdominal assessment. Just when you start, you want to observe his abdomen, look for any abnormalities, any masses, any lesions. And again, when you're doing this assessment, you would probably have the shirt up so you can visualize the abdomen, but we're not going to do that. So yeah, any abnormalities, any peristalsis, any herniations, anything that doesn't quite look normal. And then you go ahead and go right into auscultating. So I have my stethoscope here, and you would listen with the diaphragm and stethoscope, and you're going to start down in the right lower quadrant, and you're going to go around and listen to each quadrant, listening for his vowel sounds, if they're hyper or hypoactive, or if they're absent. But Justin has good vowel sounds. Okay, and then you're going to flip your stethoscope around and listen with the bell of your stethoscope. Okay. You're going to listen to the right of the umbilicus, and the right of the umbilicus is over here, and up and above, and here you're going to be listening for the renal artery, okay, and onto the left side for the left renal artery and the aorta. Okay. All right. And when you're listening for those arteries, you're going to listen for any brewery, which would be at a normal blood vessel through a stenotic vessel, which would not be normal. And I didn't hear any brewery on Justin. Next, I'm going to percuss through the abdomen. You're going to start in the right lower quadrant. Always start in the right lower quadrant. So I'm going to percuss here, and you're going to be feeling for any abnormalities. And then you're also going to be listening as you're percussing for sounds. If you're over an organ, it's going to sound dull. And if you're over a fluid-filled or an air-filled area, it's going to be tympanic. And the rest of the abdomen should sound tympanic unless you are above the bladder and the bladder is full, or if the patient needs to have a bowel movement and they have stool in their intestines. Okay, so we percuss. Now we're going to palpate again, starting in the right lower quadrant. So we're going to just palpate here all around. His tummy feels soft, non-tender. I don't feel anything enlarged. His spleen's over here on the left. Can you take a big deep breath and breathe all the way out? Okay, and that's a good way to check for the spleen over here, see if that's enlarged. And his liver over here, you can feel appears very normal. Okay, very good. And then you would state that you would be checking you'd feel for the femoral artery and for the femoral nodes, but I'm not going to do that. This completes the abdominal assessment, and we'll go into finishing the musculoskeletal assessment that we didn't finish before now that the patient is lying down. You're going to feel the hip over here, feeling that they're aligned. The alignment's very good, and that is. And I'm going to rotate his leg out, his hip. I'm only going to do the right side because I can't really quite do it on the left on the couch. And you're going to be listening for any clicks. I don't hear any clicks on his hip. So that finishes the musculoskeletal assessment that we didn't do before. This concludes both of them. Do you have any questions, Justin?
No.
Okay. At the end of your assessment, make sure you want to wash your hands, and that concludes our video.